What's going on, everybody? John Stamper, super excited. We are here. It is Spear Summit 2024, and I am very honored to be spending some time with Dr. Frank Spear. As we mentioned yesterday, we wanted to showcase a lot of the great presenters, all the things that are going on here at the Spear Summit. And as I shared with a lot of you, when we look back at the history of continuing education in dentistry, this gentleman next to me, what he has done for this industry has been amazing. And now to watch 2024 and all the new things that Spear is focused on to help dentists and practice owners thrive is very exciting. But I did want to spend a little bit of time with him, and I was actually inside the ballroom when he gave his keynote today. It was very touching. Frank, it is an absolute pleasure. How are you doing?
I'm good, John. Thank you. And it's good to see you again.
Yes.
After such a long
20
time.
years.
Yes. Yeah.
I was telling some people when I started in dentistry, I had the opportunity to come to some of your regional events and got a chance to come to campus. So it's been great to watch this grow and, as dentistry has grown as well.
Yeah, it's been quite a ride actually here.
Yeah.
Yeah. Since 16 years now. We moved the teaching business from Seattle to here in June of 2008.
Yeah.
So,
Yeah.
Yeah.
So your presentation, I wanted to share with everybody, it was the importance of creating memorable moments for your practice and your life. And, I've had the opportunity to speak with some people, Frank, talking about where dentistry is. You started the presentation with a survey from the ADA and, some information that is not always easy for people in dentistry to take in. And I feel like you left everybody, with hope of, maybe looking at their professional life, their practice in a little bit of a different way, which I thought was very touching.
I hope so. I mean, that was obviously my goal in putting it together, was to give people ways to manage and cope with some of the things that don't always go the way we'd like, whether it's in practice or in your life.
Yeah.
So that was pretty much the purpose of why the presentation was put together.
Yeah.
Yeah.
Well, it's interesting. What struck me about it is I feel like we're in this time in dentistry now where there are a lot of unknowns. There's been so many changes. And I just feel like when times like this happen, people they're in search of leadership. They're in search for, I think, the message that you shared today. I just felt like it really resonated, with where people are.
Yeah, I hope so. I mean, so far the feedback I got was really, really positive. So
excellent.
Yeah.
Can you talk a little bit about what this journey has been like for you when you look at this summit? What Spear has grown to now, a lot of the different solutions that are going to be offered, but just this journey from in the spirit of memorable moments for you as you look back.
Yeah, I have to admit that I was pretty happy in Seattle, doing my courses out of the center we had built there, but I was very limited as to what we could do in terms of how many people we could impact. And it was pretty much myself and Greg Kinzer were doing the education. And when the opportunity came up and the people down here at what was then called the Scottsdale Center for Dentistry said, hey, would you like to come down and move your business here? We'll rename the business Spear Education, and we've got this big vision. We got this, facility with a 300-seat auditorium and 300-seat restaurant and all the workshop spaces. And it's like, hadn't ever thought in my life that I would ever kind of be where we are.
Yeah.
But there have been the ability to get an incredible faculty, the ability to get an incredible visiting faculty who helps mentor, even putting this meeting on here at the JW, it's amazing to me. I look at our first summits were actually in the auditorium over at our center.
Yeah.
And they were, I'd say 250 or 300 people maybe. And, no vendors or anything like that.
Yeah.
And now here we are. And the number of dentists we've impacted through the years, the number of dentists that actually come to the center every year. I don't know the exact number right now, but I know pre-COVID, I know we were running about 5,000 to 6,000 dentists a year
Yeah.
coming through Scottsdale at the
Yeah.
center. The number of study clubs we still have, I think we have almost 750
Yeah.
study clubs.
Yeah.
You know, over 8,000 study club members, and it's really gratifying for me to see the impact we've had on a lot of dentists' lives.
Yeah. So when I think about the cornerstone of Spear, I think about the education, which I know has always been so important to you. Obviously, there's a lot of really exciting solutions that are going to be offered to help the members thrive and all of that. But can you just touch on, that educational piece and how important it was for you as the vision, as the organization continued to grow?
I started mentoring my first study club in 1983. And it was 8 dentists in Tacoma, Washington that came to me and said, hey, we hear you're really into aesthetics. I had only been out of my peri-pros program a year, but I agreed to mentor the study club. And then 1984, 2 other groups of dentists heard from that first group. And so they said, hey, would you mentor study clubs for us? So in 1984, I had 3. And by 1985, I think I had 7 I was mentoring every month. And what I realized was that it was the diagnosis and treatment planning component that was really one of the biggest missing pieces for most of the dentists. And back then, I also noticed the people who were looking for education, a lot of them had been out, let's call it 12, 15 years. And they reached a point in their career where they could do, they're experienced practitioners of being able to treat teeth. But they were feeling like, well, if this is all there is, I don't know if I can do this for 20 more years. And so what they were looking for was the ability to treat patients that they just didn't know how to treat. And that was really the core. I developed facially generated treatment planning as a concept in 1986. Well, that was the first time I ever presented it. And what I discovered is that was a system that literally any dentist who really wanted to learn how to treatment plan, that system worked for them. And ultimately, I ended up with up to, I think, 11 study clubs was the peak, around 1987, maybe. But it's always been about the clinical excellence, clinical education, diagnosis, treatment planning. And then when I moved here, it was really just logical that none of that was going to change.
Right.
It was just that I wasn't going to be doing all of it. There was going to be a team of us doing it. Yeah.
I love that. Where does your motivation for education come, right? I think with all the ebbs and flows in an industry, all the different variables, to hold on to that as such a core principle for you and to see how things have evolved, like, where did that come from?
It's interesting you ask, because I actually have a course I'm doing here now, a 2-day seminar on 4 people who want to teach. And and one of the first parts that we will talk about in September, because I'm running it in September, one of the first things we're going to talk about is what's your motivation to want to teach? And I think what you discover is at different ages in people's lives, they have different motivations as to why they want to do it. At this point in my career, I've done over 4,000 lectures in 42 years. I still enjoy putting them together. I still enjoy the feedback I get that I'm helping people. And so that's a real strong motivation for me. I got into education. It was not planned. When I was in my residency program, we had a class that was a year-long class, and it was on how to put together a presentation, how to do title slide. This is back, no digital, right? This is the 1970s. And so how do you make title slides? How do you think through the logic of putting together the presentation, the cases, the whole process about how do you present it effectively? And then your final exam was you presented it to the department faculty. And so I did the final exam, and one of the faculty happened to be a fellow named Jerry Schultz from Seattle. And Jerry had been teaching study clubs on reconstructive dentistry for years, like 20 plus years. And he was having a reunion of all of his study clubs in June of 1982. And he said to me, would you come do an hour at my reunion? And I was like, sure, I'll come do an hour at your reunion. I mean, what do I know? I don't know. I don't know whether I shouldn't do it or not. So I went and I did the hour. Well, there happened to be a dentist at the reunion from here, Phoenix, named Dale Timberlake. And Dale Timberlake was the program chairman for what was then called the American Academy of Crown and Bridge Prosthodontics. It's now called the American Academy of Fixed Prosthodontics, but same organization. And Dale Timberlake says to me, hey, I'm the program chairman for next February's meeting. Would you come do an hour at that meeting? So, and it's actually a funny story. I can tell you the exact date of the lecture. It was February 20th, 1983. And the reason I know the date is the opening speaker was a fellow named Vic Lucia, who was famous in prosthodontics. He invented the Lucia jig, and his opening lecture was titled A 30-Year Retrospective in Prosthodontics. I was 29 years old. My 30th birthday was going to be the day after I gave that lecture. So Vic Lucia and a bunch of people lectured Saturday. I lectured Sunday, and I opened my lecture by saying to the audience, you know, I can't give you a 30-year retrospective on prosthodontics because my 30th birthday is tomorrow. At any rate, I did the 1 hour lecture, and I think I had 7 people come up and say, hey, would you come do a day for us at our, study club, or our Toronto Crown and Bridge Academy had come do 2 days. And all of a sudden, everything just exploded from there.
Yeah.
That's how my whole educational career got built, was just those first 2 lectures, one as a grad student, one at Jerry Schultz's reunion.
Yeah.
And then when people saw me at the Academy of Crown and Bridge, all of a sudden I was just getting invitations everywhere to come do a day here or a day there. So early on, I don't know that I thought about what my motivation was.
Right.
Other than I had done public speaking courses in college and liked it.
Yeah.
And so I liked doing that presentation as a grad student. And it was like, yeah, sure, this is kind of fun. I'll do this.
Yeah.
I didn't think it would ever, at that stage in my life, I didn't think it would ever have the impact it's turned out to have.
Yeah.
Yeah.
Such a great story. When you look at the future of dentistry, like you've said, you've seen so many things happen in your career. A couple things that you're excited about when you look out for kind of where we're headed?
I think for sure the digital aspect of dentistry is definitely going to change and change more significantly as we go forward. And I think the better part of that is it's going to get simpler in terms of the learning curve.
Mm-hmm. Yeah.
Some of the early systems were not necessarily user-friendly.
Yeah.
The new scanners and the new printers are getting so user-friendly.
Yeah.
And people, the ability to come take classes, like one of our new classes is called Digital Dentistry.
Mm-hmm.
And it's literally getting people up to speed on kind of what's an easy way to integrate what we have currently into your practice.
Yeah.
And what's the cost and the return on investment. So I for sure think that is going to be a big part of our future. There's a few things I worry about, given that I have a son that's in his oral surgery program, a daughter that's a general dentist, and my oldest daughter is married to an endodontist. I worry about things like insurance reimbursement
Yeah.
for those younger dentists.
Yeah.
Because the insurance companies are really clamping down.
Yeah. Yeah.
And, when I started dentistry, I didn't have to live. Oh, well,
Yeah.
I chose not to live
Sure.
with that. Let's put it
Yeah.
that way.
Yeah.
And even if you were part of like a Delta Dental back then, you could still raise your fees.
Right.
Right. My daughter, they've been cutting her fees.
Yeah.
And I worry about
Yeah.
that kind of stuff within the profession itself.
Yeah.
The DSO thing, I think if you looked at that ADA survey I talked about, I mean, young dentists, their stress.
Yeah.
Over 40% of the dentists surveyed under the age of 44 had thought of quitting dentistry at least once a month for 6 to 8 months.
Yeah.
And their stress is all financial.
Yeah.
It's dead.
Yeah.
And so DSOs to me offer a chance for a young dentist to get experience and manage debt. And so do I see them as like the boogeyman? No, I think we got to have a way for these young kids
to continue to move the industry forward.
Yeah.
Excellent. Well, Frank, the last thing I wanted to ask you is you talked about in your presentation creating memorable moments. I'm sure you probably have hundreds, if not thousands, in this journey. Is there one or two that you can think about, that come to top of mind of just this journey for you and where this has all come to?
Well, certainly there's been lecture experiences which have been, I think very unique. And honestly, back when Vince Kokich, my orthodontist, was still alive, and Vince and I lectured around the world probably 150 times in different places. And there's a lot of memorable moments, and Dave Matthews, our periodontist, would join us a lot of the time. So I look back really fondly at the chance to be in some really cool places. And the teamwork of working with those two guys for 30 plus years in practice, what we kind of developed is in a lot of ways, I think we were kind of at the leading edge of interdisciplinary dentistry. We were doing it in a way that people hadn't really seen it done that way before. So that's a super memorable moment. Honestly, coming up with the concept of facially generated treatment planning, I view that as perhaps one of the biggest parts of my legacy. And then, there's certain patients that you just remember because they just were so wonderful to work with. And thankfully, I had a ton of just great patients. And honestly, some superstars on my team. And, I look back at like Debbie, who just retired May 31st. She worked for me 37 and a half years. And she was like my right hand. So I have a lot of those really big moments.
I love it. Thank you so much. This is very honored to do this. Like I mentioned, like when I started dentistry 20 years ago, I had the opportunity to be at a lot of your events, and so to be here now with you is quite an honor. And so congratulations on all your success, and best of luck of you as you continue to create some great moments.
Great. Thanks, John.
Thank you, Frank.
Appreciate it.
Yes. Thanks, everybody.